So generally, flu season starts around the month of October and goes until March. So a great time to get it is any time between those months. That's in the northern hemisphere, that's sort of the flu season. So some of the symptoms, fever, sore throat, cough, body aches. Those are sort of the general symptoms of influenza. So if you think you've contracted the flu or influenza, see your doctor as soon as possible. There are some medications that can be given to patients depending on their health history. Generally, these medicines work best if they're started within about 48 hours of the onset of symptoms. So let's say you're coming in, 5 days later, there's not a lot we can do for you. But within about 48 hours, yes, there are things we can do. Now, let's say you come in a day. You started with your flu symptoms, you come in a day later. Do you get flu medicines? Not necessarily. If you're a generally healthy person, you do not need Tamiflu. You're going to fight this off just fine with Tylenol, rest, fluids. If you're not a healthy person, let's say you've got asthma, diabetes, lung problems, those are just some examples, then you might benefit from Tamiflu. So influenza season, like we talked about, is generally October through March. That's really peak flu season. The other things that patients get other times of the year, that's not really influenza. That's a common cold, a flu-like symptom or flu-like illness, but it's not true influenza. Additionally, another point based on your question is the stomach flu. Patients will come in and say, oh, I got the flu, I got the runs, diarrhea, nausea, vomiting. That also is not influenza. That's a stomach bug. And lay people will use the term stomach flu, but it's not really influenza.